I was approached by somebody from OrthAlign with an idea, and the idea was to take the accuracy of navigation and try to get rid of everything else. All the things that made people shy away from navigation, those were off the table from minute one. And we said, you know what, do you think we can develop something that can maintain the accuracy of navigation, but that can be fast, simple, easy to use?
For the OrthAlign products, we're using some technologies that are familiar to a lot of people from their smartphones and even from military technology like drone and missile guidance. We use accelerometers and gyros, which are both type of inertial sensors.
So literally the rocket science mathematics, combine that with the sensors, and we've got the means to make a very cost-effective, very precise and reproducible device for alignment in orthopedic surgery.
OrthAlign has really helped me in performing total knee replacement surgery because it gives me the confidence in the palm of my hand during surgery, giving me real-time data. It's reproducible, meaning that it does the same thing over and over and allows me to put the knee in the way I want to.
It's very, very easy to learn and use. Surgeons typically will take less than 5 cases to become completely comfortable using it, and is designed to work within the normal workflow of the surgeon.
One of the recent studies related to the knee-align system was co-authored by Dr. Dennis Nam, and that was actually a randomized controlled study looking at knees performed with the knee-align system versus the conventional standard of care method, which is basically eyeballing. In that study, Dr. Nam and his colleagues found that tibial components put in with the knee-align system were within a couple degrees of the mechanical axis over 95% of the time. That's a very small outlier rate, especially compared to the control group, where the outliers were something around 30% or more.
The downside of the patient-specific cutting blocks are the lead time and the cost. So you need some sort of imaging beforehand, whether it's CT or MRI, and it takes weeks at least to have these prepared.
It's an attractive concept, however, in practice what I've seen is that the PSI blocks don't often fit accurately. And then when it doesn't fit accurately, you're depending on this tool that's going to mislead you.
The reason that I don't like standard console navigation is I don't like big pins and I don't like the line of sight issues that you have. It's also a lot of capital expense for my hospital, which they're not willing to do. And it's just a lot of bulky equipment in the OR that I don't really need.
Another drawback of optical navigation systems is that they are typically specific to a particular implant. The knee-align system works with any implant.
The accuracy of the knee-align system has been shown to compare favorably with conventional cast systems. In one study, the investigators found that 94.9% of components put in with the knee-align system were within 2 degrees of neutral coronal alignment versus 92.5% in the cast group. Looking at overall limb alignment, the investigators found that knees put in with the knee-align system were within 3 degrees of neutral 92.5% of the time versus 86.3% of the time with the cast system.
So basically what happens on the femoral side is you put a pin in the distal femur in the point that you call the center of the knee, and then you've got a device that's got accelerometers in it that you simply move, that rotates around the hip joint, and it identifies the hip joint. So now you've got a point that's the center of the hip, you've got a point that's the center of the knee, and you've got your mechanical axis. And then there's a cutting block that moves off that mechanical axis, and in real time you see what's my flexion angle, what's my varus valgus angle, and when you're happy with your angles, you pin your cutting block. On the tibia, it's actually even simpler than the femur. There's a probe that goes onto the ACL footprint, which is the center of the knee, and then you palpate the medial and lateral malleoli, and from palpation of the medial and lateral malleoli and collection of those points, the system calculates the center of the ankle joint. And now again, you've got center of the knee joint, center of the ankle joint. You connect those 2 dots and you've got mechanical axis of the tibia. And then from that, you adjust the varus valgus alignment and the posterior slope alignment. And in real time, on this handheld device in front of you, you see numbers. When you're happy with the numbers, you pin your tibial block.
I've been asked many times before if I trust the system, if it really does work as well as it does. And in the beginning, I double-checked everything. I dropped a rod on the femur, made sure it was within the ASIS. I dropped a rod on the tibia 3 times. And over time, I have found that it has been incredibly accurate and incredibly precise. And what I like is every single x-ray I take post-operatively looks exactly the same.
Well, it's totally changed the way I perform total knee replacements because I use it on every single case now. The nice thing about OrthAlign is that it can be used with any system, so it's a tool that I can use to perform the surgery to the best of my ability.
As surgeons, we don't like surprises. It's really nice to be in the operating room and having numbers in front of you instead of just that looks right. There's nothing worse as a surgeon than seeing your post-op x-ray and thinking, ooh, that's not what I thought I was doing. So having those numbers in front of you, having that confidence to be able to move on and say, I know that's right, it's fantastic.